Suicidal thoughts. For all too many physicians, their distress goes unrecognized and untreated, finally culminating in suicide. An estimated 300 to 400 U.S. physicians take their lives each year. This is equivalent to 2 to 3 graduating classes of medical students. You see there that the suicide rate among male physicians is 40% higher than the general male population, and in women, it's a staggering 130% higher than the general female population. In this figure here, you see data from the largest U.S. study of white male physician deaths in 28 states during the years of 1984 to 1995. That study found that when compared to white male professionals, physicians' proportionate mortality ratio was higher for suicide than for all other leading causes of death. This increased risk of suicide among physicians may start in medical school. We know from our large national studies of medical students that 11% have had suicidal ideation in the last year. And this is substantially higher than individuals of similar age in the general U.S. population. This issue of suicidal ideation is important, as we know from large epidemiological surveys that suicidal ideation is a very strong predictor of suicidal planning and attempts. Suicidal ideation is strongly related to symptoms of depression, as well as degree of burnout. We know that depression increases the risk of suicidal ideation by 6-fold, and burnout increases the risk by 3-fold. For people without depression, as burnout increases in severity, so does the prevalence of suicidal ideation. For those with both depression and burnout, the effect is magnified. Fortunately, the relationship between suicidal ideation and burnout is reversible. A large longitudinal study of U.S. medical students demonstrated a dose-response relationship between burnout and suicidal ideation, as well as reversibility. Those who recovered from burnout over the course of a year had a substantially lower risk of developing suicidal ideation than those whose burnout persisted. It's also worth noting that about 1 in 4 medical students recovered from their burnout without an organizational intervention. Now, these students, of course, might have done something on their own to get better. If you're having thoughts of harming yourself, we encourage you to reach out to family, friends, and individuals at your school, or call the national hotline. Some other resources in this section include phone numbers for local resources at your center, individuals who can meet with you, as well as on and off-campus mental health services. There are also links to select publications providing additional information on the topic, and links to other activities such as a PBS video about physicians who are struggling with mental health problems.